Okay, we're going to be talking about infant growth and development. Just point out a nice timeline here for you. In general, growth, as far as vital signs, weight, height, and head circumference, respiratory rate's going to decrease along with the heart rate. Normal respiratory rate 20 to 30, heart rate 100 to 120. And this is from 2 days of age to 12 months. Weight's going to increase, height's going to increase, and head circumference is going to increase by 2 centimeters per month. And this allows for that rapid brain growth to occur. The brain is going to achieve 2/3 of its adult size by 12 months of age. So coming over here, starting at 2 days of age, remember that infants can lose up to 10% of their body weight, but they should regain in 10 to 14 days. Car seat should be rear facing in the back seat, and we'll talk a little bit more about that in just a second. Pain scales for infants, it's a FLACC pain scale, so it's basically giving them a number for their pain based upon your observational assessments of the newborn or infant. Begin vitamin D supplementation the first few days of life for breastfed babies. The Erickson stage of development that they're going to be in during infant is trust versus mistrust. So they will develop trust if their needs are met, such as changing diapers or fed when hungry. And if their needs are not met, then they will develop mistrust. During the infant time frame, remember, mouths are pleasure producers. They like to put everything in their mouths. So when we talk about choking hazards a little bit later, this age group is at high risk for choking, especially when they start to get a little bit mobile. Moving on to about 6 to 8 weeks of age, remember that the posterior fontanelle closes around this time, so it's the smallest soft spot on the baby's head, and it closes first. It's triangular shaped. It closes around 6 to 8 weeks. 2 months of age, the baby should hold their head up while prone, and they start to develop a social smile. So if you look at newborn reflexes that start to disappear around this time frame, you're starting to see in between 2, 4, and 6 months, the startle, the moro, the tonic neck reflex all disappear. So those are innate reflexes from nature to help protect us. And when we're starting to get more mobile, then they start to disappear. Around 4 months of age, iron supplements may be needed. So up to this point, the infants had their iron supply from the maternal blood flow through the placenta, and those start to go away around 4 months of age, so they may need iron supplements starting at this time. It's recommended that you use a cool wet washcloth for dental hygiene and just rubbing the gums to make sure that they stay cleaned, and this can start earlier than this, but it's before the first tooth abrupts. Again, remember, hands and feet are objects of play. This gets mentioned again and again. They like to put their feet in their mouth once they start to be able to pull that foot back to their mouth. They should turn from back to front around 4 months of age. So if they're lying on their back to help prevent SIDS, they can actually start to turn to their front by themselves. In between 4 and 6 months of age, we're going to see the first solid foods start to be introduced. Up to this point, babies are, if they're breastfed, it's recommended that they're exclusively breastfed. The first thing to be introduced is usually iron fortified cereal, and that is linked to the maternal iron stores being depleted. So iron fortified cereals is normally introduced first, followed by fruits or vegetables. Just make sure they're introducing one at a time every 6 to 7 days. So if there's a reaction, they'll know what the reaction's from. The birth weight should double by 5 months of age. So if the baby weighed 7 pounds at birth, by 5 months they should weigh 14 pounds. 6 months of age, you can begin using ibuprofen. Acetaminophen and ibuprofen are recommended to be alternated, but you cannot use it prior to 6 months of age because of the bleeding risk factors. First influenza vaccine is recommended around 6 months of age. After 6 months of age, it's recommended that you limit 100% fruit juice to 4 to 6 ounces per day because of the high sugar content. Around 4 to 8 months of age, separation anxiety begins, so they begin to get nervous when mom or dad or caregiver goes away. And stranger fear begins. It's as early as 6 to 8 months of age, so people that they don't recognize as their parents or caregivers, they may get a little nervous around. In between 6 and 9 months of age, finger foods is encouraged to be introduced, and we'll talk about safe finger foods here in just a second. Babies will play, but solitary play, they do not play with others, just with themselves. First tooth tends to erupt in between 6 and 10 months of age. 9 to 10 months of age, object permanence begins. So if you hide something behind your back, they know that it's still there even though they can't see it. Same with mom and dad. Caregivers, if they go out of the room, they trust that they will come back, that they're still there. They begin to creep or crawl around this time frame, and cruise around 11 months of age. So they're holding on to a surface area, but they cruise around the house. So here we're starting to talk about really high risk of choking or injuries. 12 months of age, vocabulary is around 3 to 4, 3 to 5 words. They know the meaning of no. They can stand alone. Some will take their first step. 6 to 8 teeth should be present by 12 months of age. Height has increased 50% since birth, so if they were 20 inches at birth, they are now 30 inches, and birth weight should triple. So your 7-pound baby that was 14 pounds at 5 months of age is now 21 pounds. We're going to do a lot of choking hazard education because they're now mobile. Small objects can get lodged into their throat very easily. Anything that will fit inside the toilet paper roll tube is to be avoided, such as grapes. Here's some appropriate toys for the infant. They like to play with balls. This is a football, but any type of ball. Stuffed animals, rattles. They like mirrors because they can see themselves. Towards the end of the infant year, they start to, they can take their thumb and their forefinger and actually grab things, so they can start to play with blocks. They like colored objects. Safe finger foods if they're, remember, large enough healthy snacks, so graham crackers, bananas. You want to avoid hot dogs and grapes with this age group. Car seat, rear facing, always in the back seat. This harness, this baby isn't in here correctly, but make sure you know it's at armpit length, and the shoulder harness should be at or slightly below where the shoulders is. The babies should be placed at a 45-degree angle in the back seat of the car, rear facing.